Our center has a liver transplant program and a kidney transplant program, and probably the most active is the liver transplant program. And they do more living donor transplants than anywhere else in at least the Northeast, if not the US. My role in that is in seeing all of the patients as they're being evaluated for whether or not they're eligible to have a transplant, and then trying to uncover any infectious disease issues that we might not have thought of before. So it involves talking to the person, finding out travel history, job history, you know, and if people have something like latent tuberculosis, we treat that beforehand. If they've gotten a parasitic infection that's dormant, we treat that. And then I follow them all the way through the process. So it's amazing to me how few infectious disease complications they have, which I think has two things to do. One is that the program uses a less intense immunosuppressive regimen than some other ones do. But I think we're one of, not all transplant programs have a dedicated infectious disease person or people that are involved from start to finish, and I think that helps to avert a lot of the things that could complicate things later. Most of it has to do with things that are not infectious. So, for instance, if someone's too old, if their cardiovascular status is such that the risk of going through the surgery wouldn't be tolerable, things like that. There aren't a lot of things that that would exclude them from an infectious disease perspective. Some of the tropical illnesses, so for instance, if someone had been originally from South America and they had Chagas disease, that's pretty much a non-starter. We don't do HIV transplants. There's only a few centers in the country that do that. It's not that it's not appropriate to do, it's just that we're not set up to do it. So mainly things like that. But most all of the things are surmountable by treatment before or right after transplant. I think it's what they've evolved into using over time. The group actually started out at another Boston area hospital and moved to Leahy, I think in the 1980s, 1990s. And they've developed their protocols over that entire period of time. It hasn't changed much since I've been there, but compared to some other places I've been, some of the immune suppression is not nearly as intense.